The ventricular pressure volume loop describes the one complete cycle of ventricular contraction, ejection, relaxation, and refilling in the graph form. There are two axes, a horizontal axis that represents left ventricular volume and vertical axis that represents left ventricular pressure. For explaining this, we will consider only left atrium and left ventricle, but keep in mind that right atrium and ventricle have the same stages. The cycle begins at point 1. In this period, ventricle is full of blood, that called end-diastolic volume. It is approximately 140 ml. The corresponding pressure is quite low, because the ventricle before the point 1 was relaxed. At the point 1, the ventricle is activated. It starts to contract, and ventricular pressure increases dramatically. When ventricular pressure becomes higher than atrial, mitral valve closes and creates the first heart sound. In this time, aortic valve is closed, because the ventricular pressure is still lower than aortic pressure. So no blood can be ejected from the left ventricle, because all valves are closed. It means the volume of left ventricle remains constant, but due to contraction, pressure becomes quite high. And in the volume pressure loop we see it as a vertical line. According to constant value of ventricular volume, the stage called isovolumetric contraction. When ventricular pressure becomes higher than aortic pressure, it leads to opening of aortic valve. After the opening of aortic valve, blood is rapidly ejected from the left ventricle to the aorta by the pressure gradient. The opening of aortic valve is represented by point 2. Ventricular ejection starts from rapid ventricular ejection and goes to the reduced ventricular ejection. In period of reduced ventricular ejection, ventricular pressure falls because the ventricles are no longer contracting, but blood continues to be ejected into aorta because the aortic valve is still open. At the point 3, ventricular pressure decreases below the aortic pressure, that lead to closing of aortic valve. Closing of aortic valve produces the second heart sound. The volume remaining in the ventricle at point 3, or in the end of systole, called end-systolic volume. Usually it is equal 70 ml. The width of the pressure volume loop is the volume of blood that was ejected, or stroke volume. So stroke volume is the difference between the end-diastolic volume and end-systolic volume. In this case, it is equal 70 ml. So in this situation, at point 3, aortic valve is already closed, but mitral valve is not open yet. So all valves are closed, although ventricular pressure decreases rapidly due to relaxation, but ventricular volume remains constant. According to this stage called isovolumetric relaxation. At the point 4, ventricular pressure falls lower than atrial pressure. That causes opening of mitral valve, and blood starts to fill left ventricle. The stage called rapid ventricular filling. In this stage, the left ventricle fills with blood from the left atrium passively. The rapid flow of blood from the atria to ventricle produces the third heart sound. The last stage of cardiac cycle is reduced ventricular filling, is the longest phase of cardiac cycle that includes the final portion of ventricular filling. The stage occurs at a slower rate than the previous one. Atrial systole that occurs in this stage marks the end of diastole and produces the fourth heart sound. Normally, the third and the fourth heart sounds are not audible in adults. After reducing ventricular filling, cardiac cycle again starts from the point 1 and repeats. Ventricular pressure volume loop can be used to visualize the effect of changes in preload, afterload, and changes of contractility. This is the ordinary volume pressure loop. Let's start from preload augmentation. Preload is represented by end-diastolic volume, so increasing of preload means increasing of end-diastolic volume. When end-diastolic volume increases, it means myocardial muscle becomes more extended by blood. That by Frank-Sterling law lead to increasing of stroke volume. So if the end-diastolic volume increases, it means first and further second points of volume pressure loop move to the right and graphs become wider. As we already mentioned, graphs widths reflect the stroke volume. So if the preload increases, stroke volume increases too. The next step is augmentation of afterload. Increasing of afterload means increasing of aortic pressure. In this case, left ventricle must eject blood against greater than normal pressure. To eject blood, ventricle pressure must rise to a greater than normal level during isovolumetric contraction and during ventricular ejection. So second point moves up. Left ventricle spend more of the contraction for isovolumetric contraction to match higher afterload. And according to this, left ventricle less of contraction is left over and available for ejection of stroke volume. The stroke volume is width of graph, so if the stroke volume decreases, graphs becomes narrower and more blood remains in the left ventricle after ejection. As a result, end-systolic volume increases. The last step is contractility augmentation. When contractility increases, it means ventricle can develop greater tension and pressure during systole and eject a larger volume of blood than in normal condition. So graphs becomes higher and wider that lead to shift of points 3 and 4 to the left. Stroke volume increases, as does ejection fraction. Less blood remains in the ventricle at the end of systole, and consequently end-systolic volume decreases. If you like the content, press like and subscription buttons. Have a good day!
Here we go.